Welcome. We're so glad you're here. I wanted to introduce our webinar today from the Stanford Parenting Center. Of note, you can follow us on Instagram. I've put the information into the chat, and it is at Stanford_parenting_center. Today we are offering a Parenting Through Uncertainty consultation group. This is for fall 2021. It's a 4-part webinar caregiver support series brought to you by our center. It will be run by Dr. Ock, who is today's presenter. And I will also put information into the chat for those who may be interested here. We also have a Parenting an Anxious Child consultation group run by Kyle Cassidy. And this is, again, a 4-part webinar series beginning in mid-October. If you are interested, please reach out and let us know. Information is also in the chat. And then finally, we wanted to let you know about our Navigating Adolescent Substance Abuse and Behavioral Addiction series. This is, again, for fall 2021, a 6-part webinar caregiver support series and run by Karen Parsons, licensed clinical social worker with us. Again, please reach out with interest. And finally, I'd like to introduce Dr. Emily Ock. She is a colleague, a pediatric psychologist and assistant clinical professor in the Department of Psychiatry at Stanford University. She was born and raised right here in Palo Alto and completed her Ph.D. in clinical psychology at Ohio State University, followed by internship at UCLA. She completed her postdoctoral fellowship on the Pediatric Consultation Liaison Service at Harvard Medical School and Boston Children's Hospital before returning to join the faculty here at Stanford. Her clinical interests have long centered on pediatric hematology oncology patients and their families, and she previously ran PACT, Parenting at a Challenging Time, at the Stanford Adult Cancer Center, which focused on improving communication between parents facing a serious medical condition in their children. The goal of Dr. Emily Ock's work is always to partner with families and empower parents to support their children and foster resilience regardless of the challenges the family may face. Welcome, Emily.
Muted, sorry. Thank you very much. It's a pleasure to be here. And this is obviously a topic that comes up frequently. And I think the last year and a half is certainly no exception, and it's kind of added a new lens and layers to this sort of coping with uncertainty and how do we support our kids, sort of across the age spectrum in the face of so much uncertainty. I have no conflicts of interest to report, and I also want to thank the Stanford Parenting Center for having me and supporting this talk, and obviously the Child and Adolescent Psychiatry Division here at Stanford. The other acknowledgement, and there's some information at the end, is Dr. Paula Rausch, who actually founded the Parenting at a Challenging Time program. She's been an incredible mentor to me and really helped shape my sort of understanding and work in this area. Next slide. All right, so I figured we'd just start with a little definition of uncertainty, because every single permutation that is listed according to the dictionary, I think, characterizes some element of the last, we'll call it 18 months. We all know it's gone on longer than that. And for many, many families, really, it's been a matter of layers of uncertainty. All the sort of typical events that may stir uncertainty against the backdrop of a tremendous amount of uncertainty, caused by the pandemic. In this particular moment, things seem, we know that many kids are back in school in person. We now have a little bit of a better sense of kind of what that is looking like. But, there is, so while we may be in a slightly more kind of predictable moment, it may just be a moment and we don't really know. So, that with layered on top of it, whatever other events and challenges that families may be facing. If, in the course of this talk, you have particular questions or areas of interest, if you don't mind putting that into the chat, and I will do my best to address that as we go along. So uncertainty is hard for adults. It is hard for kids. And you put that together and it's certainly hard for everyone and for families. And kids are inherently looking to their grown-ups to sort of gauge how to respond and learn how to cope when things are unpredictable. So we want to, part of the goal of this talk as we go along is to hopefully give parents and caregivers some new or additional tools to model coping with uncertainty and supporting their kids, during those uncertain times. And okay, yeah, that's fine. The tendency when we face uncertainty, because it's often uncomfortable, is to avoid. And the thought process is also that if we can avoid, not only is it a little bit more comfortable in the moment, but a lot of times parents are then thinking, well, I'm protecting my child. If we find it difficult ourselves, then it's very understandable that we wanted to try and protect our kids from experiencing, that same or similar discomfort. But as we see, as we go along, we'll see that very good intention is often not in the child's best interest. So we've always lived with some level of uncertainty, of course, but the pandemic has increased it and sort of introduced it in multiple areas of our lives. And people, adults, kids alike, respond very differently to uncertainty. For some people, it immediately spikes, levels of anxiety and sort of distress, whereas for other people, they might have an easier time just kind of going with it, rolling with the punches, seeing how it unfolds, and it may not, have a tremendous impact on their sleep or appetite or, focus or mood. But the overall impact on both child and parent functioning can be significant. So I used to start this talk with, or a version of this talk, with statistics on, the number of kids living with a parent, in this country, living with a parent undergoing cancer treatment, and, given the fear and uncertainty, that one diagnosis alone, and, we're talking millions of kids living in that situation. But that was before any of us had heard of COVID or, and the phrase global pandemic, probably conjured up, 1912 influenza images. But at this point, we are all far more familiar with various shades of uncertainty, and we all need to learn ways to cope with it, sort of regardless of what the stakes are. So next slide, please. All right, so clearly there are different sort of versions or forms of uncertainty. And as adults, we may sort of see that, see them as sort of having a very different level of importance or sort of hierarchy of importance. So, everything from waiting on, test results to, whether or not a diagnosis is, going to be terminal. Or for kids, whether or not a birthday party is going to happen that they've been looking forward to is actually going to happen, or whether they're going to be able to have the birthday party that they want, envisioned, or a family trip is going to happen, or grandparents are going to be able to come visit. We talked about school for a moment ago, like whether school is going to be in person or revert to being virtual. And while for adults, we may kind of place greater weight on some of these more sort of high stakes situations, it's really, really important to remember that kids may not. And for them, whether or not that birthday party happens is really, really important. And the first step in all of this is going to have to be to validate their feelings. We don't have to agree with them. It's not our job to convince them that it's, grandma's cancer diagnosis and outcome is more important than whether they can have that in-person play date. Because for them, very appropriately from a developmental standpoint, those things are very important. And so it's critical for parents at the outset to recognize, acknowledge, and validate the child's feelings. And we'll talk a little bit more later about, kind of strategies for doing that. And not surprisingly, approaching some of these topics of, or areas of uncertainty, like a birthday party or travel, may feel a lot easier than approaching some of these other conversations. So hopefully, the rest of today's talk is going to both make a convincing argument that talking about it, the hard stuff, is very important, and that silence or avoiding the conversations, even if it's thought to be for the child's protection, is not actually in the child's best interest. Next slide, please. All right, so I cannot tell you the number of sessions I've started with families where the first thing that they tell me is, number one, the kids know nothing, and they plan to keep it that way, and sort of indefinitely. And inevitably, when I ask and sort of learn more about what is sort of led them to that approach, it is very well intentioned with the goal of protecting the kids. So let's next slide, please. Okay, so there, with that sort of umbrella of protecting kids, there are many reasons that parents may initially kind of avoid these harder topics. Often fear is driving it. The sort of not being sure how to approach it or how to do it, quote unquote, right, and they don't want to cause more distress by doing it, quote unquote, wrong. The kids haven't asked, so clearly they're not thinking about it. So why would we bring it up? And as I said, it's sort of this masked desire to protect the child, but also it's more comfortable sometimes for the parents. And often these have unintended consequences. And one thing I'll say is this idea about not messing it up or doing it right. This is, as we'll talk about, really, I encourage parents to think about this as sort of opening a conversation. This is not like a one and done kind of thing where there's a right or a wrong, but rather you're sort of opening a conversation that will take, sort of have multiple episodes or chapters over time and evolve as situation changes. Next slide, please. So if you're not convinced yet, a couple of thoughts around sort of the cost of this silence. So it often will send the kids unintended messages of, you can't handle this. Whatever this, the big scary thing is, it's too big, it's too scary, it's so big and scary, we can't even talk about it, so we're not going to. And that often leaves kids even more nervous or more worried than they might be if a conversation, were allowed to happen. Kids are incredibly savvy. So it's incredibly unrealistic And we're sort of not giving kids enough credit if we think they really don't know what's going on. They will pick up on things, whether it's, higher levels of parental stress or conflict between parents because of that stress, more phone calls that the parent is stepping out of the room to take, papers being left around that a kid who's old enough to read reads. I had one family where they hadn't told I want to say middle school or high school age kids about a parent's illness, but suspected they knew because the child found an after visit summary from the oncologist on the counter with mom's name and read it. But they still hadn't talked about it. So kids are going to pick up on stuff, even if they can't read yet. And better that they hear factual information from a parent versus catching wind of it, on the schoolyard from another parent. So ideally, and additionally, then the parent has, or the caregiver has a little bit more control over what information is shared and the manner in which it is shared. If the child ends up learning from somebody else, what's going on, they may feel stuck in a somewhat impossible position of sort of having this information, but also having received the message for it's not having been talked about, that they can't ask about it or they can't talk about it. And then, they're sort of left in this limbo and holding potentially scary or upsetting information that may or may not be their understanding of which may or may not be accurate, but not having anybody to really process that with, which could actually make, kind of the child's experience more difficult than necessary. And eventually, when kids learn what's going on, it's really not if, but eventually they will learn, it can really rupture the trust between parents and kids if they, the child learns that parents have this information and we're keeping it from them. And, what does that mean about how the parents view the child's capacity to handle it? And the sort of implications for that parent-child relationship. And we'll get into lies in a little bit. All right. So in addition to some of the negative outcomes that avoidance and silence can bring with them, there really are significant benefits of open communication. So as we talked about, it's often fear, especially around the topic of death and discussing death with kids, that limits this open communication. But research shows that kids and teens really want to know about their parents' illness or other big sort of topics and events that are happening within their family. They want to be in the loop. They want to be kind of a part of and included in what's going on. And it doesn't mean that, just because they want to be a part of things, that it won't be hard or that it won't, bring with it some level of distress. But it's also an opportunity to send kids a message that we believe in them and we believe in their ability to handle difficult things and model for them in a healthy and supportive way how to cope and build resilience. Next slide, please. So sorry to say, you're going to have to talk about it. So I want to now talk a little bit about some of the more practical aspects of, sort of ways to think about how to go about that and how to frame those conversations and hopefully help parents feel more confident in opening up these harder to have conversations where there often aren't any sort of concrete answers because the situation's, either health related or other things are uncertain. Next slide, please. All right, so we want to increase parental confidence in having these conversations, address whatever concerns or barriers that parents, feel exists to them having the conversations, and then ultimately increase communication within families. All of which, the ultimate goal is to increase, child well-being and the family, communication in the family unit. So the first step in all of this, next slide, sorry, that we've already mentioned, and we'll actually delve deeper into in the 4-part series later this month, can really serve as a really important backbone to and sort of backdrop for these conversations. So go ahead and sorry, the next slide. Okay, so this is, I don't know if any of you guys are familiar. I think it's a blog and an Instagram handle called Big Little Feelings, and they tend to be pretty spot on with supporting, kind of strategies for supporting kids. But I really liked this sort of description of what it means to validate feelings and why it's important. So when you okay your kids' feelings, when you validate it, you're helping them recognize, name, and manage their own emotions, which will help them become emotionally healthy adults. We don't have to agree with what they're feeling, but by naming and describing it, we're sending them the message that whatever feeling you're having is okay, and we love you anyway. So some examples of validating language might be, I know this is really hard. It's hard for us grown-ups too. Or, I know you're really disappointed. I understand that. And, we'll figure it out together. I know how much you were looking forward to Grandma and Grandpa's visit. And I know, it seems like you feel really sad that they're not able to come. I understand. So this can be a really helpful tool and sort of to have in the back pocket anytime a kid throws, literally or figuratively, throws something your way that you're not sure how to answer. So to sort of validate what they're saying, and then in turn, it sort of buys you some time. So when in doubt, name and validate the child's emotion and keep that as a tool, as sort of a first path at any point during these conversations. So next slide, please. All right. So in thinking about this sort of how to approach these conversations, there's sort of four layers or 4 levels, and we'll go through each of them sort of in order. So the first is to prepare in advance. So next slide, please. Okay, oh yeah, next, there we go. Yeah, so this is really about the practicalities. So thinking about what is the best time to talk, to these kids. Doing it right before bedtime when they have to go to sleep because they have to get up in the morning for school, maybe not the best time. They're tired, long day, need to go to bed, might not be ideal. A lot of times for teens, it's when they're, sitting next to you strapped into the front seat and you're driving and they have nowhere to go. So you kind of have that captive audience. There isn't a right or a wrong, and that's going to be kind of a recurring theme here, but it's about thinking through what you think is going to be best for your family. Who's going to be present? If there's a partner or another parent, sometimes it's, you may want to have everybody present. Who does the talking? This sort of comes from thinking about how I'm just going to say parents, caregivers, whomever's involved, sort of anticipates their own emotional reaction. If whatever the topic of discussion is particularly emotionally charged for one parent, they may decide in advance that it's the other parent who's going to be in a better position to kind of present the information. There's no, it's 100% fine, normal, healthy for the kids to see a strong emotional response in one of the parents if it's particularly difficult. The one thing I would say is that if you fear that one of the parents is sort of their emotional reaction is going to be so big and sort of out of control that it might be frightening to the kids because perhaps they've not seen that before, then you might want to think about sort of structuring the conversation differently. But it's important for kids to see that their grown-ups have big feelings and can handle them, and it's another opportunity to model that. The other thing, as I've mentioned previously, is this idea that this is many conversations. This is not just we're going to talk about this once and then pretend it never happened. So it's really, so hopefully that sort of reduces some of the pressure, to sort of opening the conversation. The other thing that I will note is, depending, if there are multiple kids involved, depending on their age, their respective ages, you may want to think about whether or not you talk to the conversation happens with them together or separately. Because as we're going to get into, what is shared, ought to vary based on the developmental sort of age and level of the kids. All right, so next slide. The other things that we ask parents to think about before these conversations is, what has the child been told so far? Like, what were the actual words that were used? For instance, if cancer is the discussion to be had, has that word been used already? Is the child familiar with it? What is the child's other sort of associations or experiences with cancer? Do they, is there a grandparent who's passed away? Did the dog die of cancer? Does a classmate, have cancer? What are going to be their associations so that we can sort of proactively anticipate how to respond to those? How has the child faced other sort of big transitions or uncertain situations in the past? And how can we take that information about the child's prior reactions and sort of incorporate that and anticipate that in, sort of this next phase? What are the parent-specific concerns, and whether there are any particular specific questions that the parents are afraid the child may throw their way, or conversations they're afraid to have. All right, next slide. All right, so developmentally appropriate. You've heard me say this, and I will say it many, many more times. So this is key. Thinking about the child's age and with it their developmental stage ought to be a huge element that guides what information is shared and the manner in which it's shared. So specifically, the language used, for instance, with a 4-year-old is going to be and should be very different than what is used with, say, a 15-year-old. And so the language that gets used to describe what's happening needs to be adjusted accordingly. We want to be clear and concrete, particularly for younger kids, which we'll get into in a minute. And over detailed is not the definition of honest. So we don't have to tell them absolutely everything to, achieve our goal of open, honest communication. It's okay to be vague. We never want to lie, which we'll get into in a second, but it doesn't mean we have to tell them every single nitty-gritty detail. All right, okay, sorry, next slide. All right, so thinking about developmental stages, this is a sort of rough overview. Again, something that we'll get into sort of in more detail in the 4-part series. But how kids understand illness, understand uncertainty, understand time, and obviously, more complex concepts and abstract concepts depends, varies wildly based on their age. So we tend to break, when we're thinking about kids and development, we tend to break it down into these sort of 5 age groups. Next, please. So I'm not going to go through this in a tremendous amount of detail. Oops. Yeah. Okay. But just, quick overview. At this point, at this age, kids aren't going to remember specifics, but how the situation is handled, certainly does influence attachment and bonding and how kids are learning to regulate themselves. So what's most important is sort of maximizing consistency and caregivers and creating sort of routine and familiar environments. Sometimes families, if for instance, a parent is going through treatment and is going to spend, periods of time in the hospital, creating, some kind of picture album or kind of scrapbook, letters, journals, video diary, that the child can sort of reflect back on in the future when they're a little bit older, since it'll always sort of be a part of their story, but they won't necessarily have memories of it, can be kind of a nice way to sort of set the stage for them understanding it as they get older. All right, next slide, please. All right, so preschool, obviously kids are, getting more verbal and better able to understand some things, but they're also masters at fantasy and magical thinking and associative logic. So just kind of like drawing connections between things, but that egocentricity, that they, everything sort of revolves around them and that they are at the center of things, which developmentally is extremely important and normal. You put those things together and they are quite likely to think that something was their fault, caused by some action on their part. So I didn't eat my green beans like mommy told me to. She got mad. That's why she got sick. It's my fault. Obviously, that is not accurate. But knowing that that is the tendency developmentally of kids sort of in this age bracket, we want to preempt that and provide reassurance and information that that's not how these things happen, and the child is not at all responsible. And at the same time, continuing to encourage, to sort of maintain routines, set limits, consistent limits that were being maintained before, and to sort of anticipate a disconnect between how the child is behaving and what they may be saying. So not to sort of overinterpret their behavior. So if they're, having a meltdown because they wanted another cookie, they may just be having a meltdown because they wanted another cookie, and it not sort of extrapolate that, it's a sign that they're really struggling, say, with the unknowns. Next slide, please. Elementary kids are very concrete, but getting sort of more complex understanding. They're focusing on, they understand that people get sick through, illnesses may be contagious, that cancer may be caused by cigarettes, but then very concrete, but mommy never smoked, so why is this happening? It's not fair. So again, sort of with that in mind, being able to a little bit better anticipate what types of questions a child might ask or be thinking about, so that we can kind of preempt that and support that. So at this point, giving very simple explanations using concrete language, and at this point, obviously we can solicit, questions from the child a little more easily. They'll be better able to express themselves. Next slide, please. Adolescence, full-blown abstract thinking, still frontal lobe not fully developed, but often a huge disconnect between their intellectual understanding and their behavior. So they understand, let's say, that a parent is very ill, or, maybe, facing death, but they still want to go out and hang out with their friends. A lot of times parents have, struggle with this because they think the child ought to want to stay home and want to spend all the time that they possibly can. But in fact, they're, opting for spending time with their peers. And that's actually very, very normal. And it's a coping strategy, and it's healthy. And we want to encourage and sort of help teens and families strike a balance there, and support those relationships, but also be very cognizant about not assigning kind of caregiving or parenting roles or expectations to kids in this age bracket, especially girls, and sort of being mindful of any sort of risky behavior that they might be engaging in. Next, please. All right. So as we said, we never want to lie to a child. Often it, again, much like the well-intentioned, secrets, it's almost always comes from a place of wanting to do right by the child. But what happens is it puts us adults in a position of having to go back on what we said, which can rupture trust. So much better then is to think of it as providing layers of information. So we don't have to tell them everything, but we're laying a groundwork. We're sort of establishing a framework that later on, as either more information is available or the child is older and better able to kind of process more details, we can go back and fill it in. So, in a developmentally appropriate manner. So next slide, please. Oftentimes we think that we're sort of softening the blow if we kind of like spin it or kind of shade it in a certain way. But if that's not accurate, like I feel like I spend a lot of time in sessions, I'm like, but is that true? When parents ask, well, can I just tell them this? And I typically say, well, is that true? And if they say, yeah, then sure, go ahead. Then that's totally fine. Well, not exactly true. Then no, we need to be more straightforward and honest. But again, it doesn't have to, we can be vague, because we want to preserve that trust. All right. So responding to questions, as we said in the beginning, sort of not being sure what kids are going to ask is often perceived to be a huge sort of barrier or source of worry for parents. And this, if people take away just one thing only from today's talk, I hope it's this, which is you do not have to answer a question in the moment. Even if you have factually the information, you don't have to answer immediately. Good questions deserve good, thoughtful answers, and it's okay to buy yourself time. So validate the question. Wow, that's a really good question. You really, put some thought into that. I don't have the answer, or, I'm not sure, but I'm gonna do my best to find out and get back to you, whether that's then talking with the doctor or, gathering more information, or just sort of taking some time to kind of think through how to respond in that, developmentally appropriate way. There is no harm in taking some time to figure out an answer. There may not be, one answer, the answer, and circling back. And as long as you circle back and follow up, there is no harm in that. So keeping this in mind often helps parents feel like whatever comes their way, they have kind of an out for. And I would say the most commonly feared question is some version of, are you going to die? Or is, whomever is ill going to die? And we'll talk about sort of language around death in a second. But being able to sort of pull this out or say, that's a really good question. I need to find out some more information can really kind of lower the anxiety in the moment. Next slide, please. A couple other things when we're responding to questions is to avoid promises. We don't have crystal balls to know the future, and we never want to make promises that we can't keep. So we want to validate feelings, keep the child updated in a developmentally appropriate way, while also taking into account how much information they want. So this really applies for, probably school age and above, but asking them, do you feel like you're getting enough information, or do you want more? Sorry, I'm reading I will answer the question with examples of providing information layers in a moment, or towards the end, so I can give a fuller example. Obviously, how we respond to questions is going to be different if we're talking about, something like an illness versus like whether a birthday party is going to happen. And the stakes are different, but as we talked about in the beginning, for a child, they're both very important. So we want to take that seriously and, kind of circle back. All right, next slide, please. All right. So the next two slides are just sort of some examples that, kind of come up around just language for medical interventions and death. So thinking about how to describe the illness or the treatment in developmentally appropriate ways. So, and, what's going on. So in terms of like the treatment, that the doctors are working very hard to help, daddy get better. Examples might be, there's something, if there's a tumor, there's something growing in, mommy's breast that isn't supposed to be there, and the doctors are working very hard to make it get smaller, or that it, and it's making her sick, or, leukemia, the blood is sick. An example, just sort of more relevant these days for many people, is this idea of, well, not the idea, but like, kids having to get COVID tests. And well, what is it going to feel like? So, we can't promise exactly what it's going to feel like, but how we describe the experience shapes how a child experiences it. So, thinking about it as, the swab is like a magic wand that's going to tickle your nose is accurate. I mean, we're calling it a magic wand, but that's something a kid, a younger child can certainly relate to. And it's an example of putting it into developmentally appropriate language. All right, next slide. This is just one example. If it's cancer that's being discussed, using an example of, cells are like Legos and they all are supposed to fit together, but sometimes there's a broken Lego. And when that happens, the rest of them have a hard time working together. Or, cancer, is sort of an umbrella term like dogs, but when we say dogs, there's, lots and lots of different kinds, and they behave differently, they look different. We know, more about some than others. And that's, again, probably for an older child, but another example of ways to kind of make the concepts more accessible in a developmentally appropriate way. All right, next, please. This could be, Thanks. This could obviously be, a talk or 12 in and of itself. But just a couple of quick thoughts on ways to talk about death. Be mindful that in our culture, especially, we use a lot of euphemisms. And for kids who are concrete, that can be very confusing and easily misunderstood. So if we say, we lost grandpa, well, that child, the chances of a young child being very afraid of getting lost, quote unquote, at the grocery store, at the park, and becoming perhaps more clingy, let's say, goes up. Or we had to put the dog to sleep. Well, that kid is probably not going to go to bed quite so easily, subsequently. So being aware of the language we use. And one very concrete example that works for younger kids is the idea that the body stopped working, that it was too sick and it stopped working. And that's what it means when somebody dies. All right. Next. Okay. So this, as we sort of wrap up here, just a couple of reminders that emotions come in waves, and that's true for adults, and that's true for kids, and sometimes they're big, and sometimes they're small, and sometimes they knock you down, and sometimes you can just bob with them. But that's sort of by definition what living with uncertainty is, that it sort of ebbs and flows, and the goal is to be able to kind of bob with it to the best of our abilities and to support our kids in not getting knocked down. Though that will happen too, and that's okay. Following, facilitating open communication, respecting kind of how much information the child wants or doesn't want, and keeping the child updated and in the loop as stuff evolves. And if possible, again, assurance, not promise, that nothing is, imminent, providing that. So, the doctors are working really hard to help mommy get better, if they, so we expect that she's gonna, be here for at least a couple of months or whatever, but not making promises, but also not, giving some sense of time frame to the extent possible. Next. And this is just a way to think about sort of challenge and trauma versus, sort of and resilience. So a challenge is sort of a combination of adversity plus that support and connection and communication, and that builds resilience. Trauma is really that adversity without the support, without the tools, without the kind of thoughtfulness and tools to communicate and build understanding. So I think a lot of times parents worry, I don't want to traumatize my child, but which of course nobody does. At the same time, by coupling these, big, scary, uncertain things with that support, with that opportunity to, talk about it and, be a part of, the family discussion, you're coupling that adversity with the support that then builds resilience. Next slide, please. Just a couple quick thoughts in terms of when to consider additional support. If there are real persistent changes, and this would be true in a lot of circumstances for kids, but persistent changes in sleep, appetite, playing, doing things that they normally enjoy doing, decline in school performance, or somehow they're not functioning and doing the things that they normally do, but with an emphasis on it being a diversion from the particular child's baseline. If we're talking about a kid who's never been particularly social, well, then that's not, and they don't want to hang out with friends, well, that's not going to be, that's not going to be our litmus test. All right. Couple resources, some from the PACT program folks at Mass General, a few other resources, some, not necessarily geared towards illness, but concepts that certainly apply to just talking about things that are uncertain with kids. The next is some more illness-specific resources. And now I think it's time for questions. One of the questions I'm seeing here is, can you provide an example of providing information in layers and stages versus omitting important details that would be interpreted by the child as lying? So I think, yes, I mean, there's sort of lying by omission, but, that's where we want to take the child's developmental, level into account. So I'm trying to think of an example. So maybe letting the child know that, the parent has, such and such an illness, and this is the plan for treatment. Maybe, the parent isn't comfortable sharing, initially that some of that treatment, a chunk of that treatment is going to be, inpatient. So you leave that part out and share it later. So you're not telling them that you're going to be, home and able to pick them up from school and doing all the normal parent things during treatment, but you're not telling them you're going to be in the hospital for a stem cell transplant for, weeks on end. I'm sure I can come up with another example, but that's at least one. I'm reading the next question. Okay, so the next question is about essentially regression, and in this particular case around potty training. So, one thing to keep in mind is we, and kids as well, regress under stress. So when there are big changes, pandemic, school gets, turned upside down, it's not at all uncommon for kids who were originally potty trained to regress and to start having more accidents. And it's, it certainly can be, a sign of anxiety, but also just of substantial sort of upheaval. And, in those circumstances, regardless of whether or not there's regression, doing our best to reestablish predictable routines, even if those routines end up, having to shift yet again, giving kids as much sort of a heads up as possible, and creating as much stability as we can, knowing that things are uncertain. And just because a kid doesn't want to talk about something doesn't mean their ears don't work when parents talk about it. So a lot of times, kids don't want to talk about the fact that they had an accident, but can overhear a intentional conversation that is intended to be overheard by the child between parents, for instance.
So Dr. Ock, an amazing presentation. I'm conscious of time.
Yes.
And I know that we should probably wrap up. We have some amazing questions.
Yeah, these are very good questions.
Yep. So I don't know if you want to potentially take one more.
Yes, let me.
And then we can sign off, and we really appreciate everyone's attendance.
Okay. Okay, so I will try and wrap these three up, kind of. So kids will have different reactions to hard news, and sometimes they will shut down, sometimes they will immediately pivot and go back to playing, and as if nothing has happened, and everything in between. And that's totally normal. And even if they've shut down, just continuing to sort of check in with them, give them some space, check in with them, let them know that you're there to listen and to talk more. And sort of keep those lines of communication open, even if for some time they end up being kind of only one direction. In terms of questions about like, will the pandemic ever end? I think it's everybody's question. And the answer is certainly, but we don't know when. And we're, kind of focusing on the ways in the things that we and kids are doing to sort of be able to do normal things, like we wear a mask so that we can, that keeps us safe while going into school in person. And yes, once kids can be vaccinated, hopefully you won't have to do that. But for right now, here are the ways that things are going back to the way they looked before. And again, validating. I know it's so hard. We've been doing this for so long. We all, everybody would like, things to go back to the way they were. And, highlighting the ways in which things in many ways have, gotten closer to normal than they were in the beginning. Let's see. I think the last question, where did it go? The question is, worrying about a grandparent's health and dying. I think being very straightforward with the child, say, grandma is very sick, and for right now she's stable, and we don't expect her, assuming this is true, to die anytime soon, or she's getting sicker and sicker, and if it looks like she's going to die very soon, we'll let you know. And then again, validating those feelings. And just because the kid again doesn't want to talk about it doesn't mean they can't hear you when you are sharing these sentiments with them. So for obviously we need to wrap up. Really great questions. For a deeper dive into many of these topics, that will be in the 4-part series that I'm going to be leading starting later this month. So hope